No, she. No, yeah.
Hi,
Hi, good evening.
good evening. So, hi everyone, and welcome to our latest AMA or Ask Me Anything. So, this week we are talking about the topic of menopause and diabetes, and we have our expert Amisha here to explain to us what these twin challenges are about and how to deal with them. Hi, Ami, how are you?
I'm good. How are you, Anushka?
I'm good. How's your new year going?
Super.
Okay, that's great. So, I mean, I just wanted to start with, when we talk about menopause, can you explain to us what exactly it is? Just
So,
to start.
menopause usually, so first of all, it occurs only in women. Secondly, it is the time that marks the end of your menstrual cycle. So it's a natural process. So woman has this, every month they have this menstrual cycle happening where the hormones estrogen and progesterone works to get you an ovulation and help you and get you into periods. So in menopause, the reproductive hormones, these are the reproductive hormones which starts to get declined, and ultimately your periods stop. So this is called as menopause, and how it is termed is from if you don't get your periods for exactly for a year, that is 12 months, then you have to make sure, like, that is a period where you have to understood it is you are into the menopausal zone, and which usually occurs between 40 to 50 years of age. And for some female it is genetic, so as per their mothers we usually ask, like, what age your mother got the menopause, or what age you got your first periods, and then from that you count 30 to 35 years, so we can estimate that whether you are into a pre or into the menopausal zone. So this is how the menopause is termed.
Okay. And you said that 12 months without a menstrual cycle, that's roughly how we calculate. And what are the symptoms that we can expect to see at that time?
So every female has a different symptom, so it's not all the females go through the same thing. The luckier one doesn't even know that they have got the menopause and they are done and dusted for life. And for some it is like a trauma, like they get everything which is not expected, from mood swings, hot flushes at night, vaginal dryness, sleeping issue, anxiety, depression. Then there is the urine, uncontrollable urine. So there are urinary tract infection recurrent. So there are many reasons, many symptoms attached to it. So for some female who are the luckier one, they even don't know what is, like, what happened in their menopause. There is a heavy bleeding which is happening, or there is painful periods initially for like it comes once in 6 months, once in 3 months, that is called as a perimenopausal phase, that you are about to get it. So when such things comes up, the first thing I would advise is, you should go and visit a gynec. You should not treat it naturally. You need a help of a doctor, because sometimes this can aggravate it to the really harder zone, and you might fall into a different place. So it's always better to keep your doctor under loop.
Okay. Obviously, with all of these symptoms and all of these changes, there are going to be impact on a person's health. So, could you talk a little bit about the broad ways in which health gets impacted?
So first of all, we say ना, menopause से पहले आप अपना health बना लो अच्छे से. The reason is the women are very blessed with the hormone estrogen. This estrogen is, I would say, a shielding hormone which is protecting you to prevent you from many of the health conditions. And once you reach the menopause, and these hormones go like completely, from zero to नीचे जाता है, तो सोचो बॉडी की हालत क्या हो रही है. So when that goes down, there are a lot of hormonal changes. On top of that, there is an age condition. Then there is a lifestyle issue. ये सब mix होता है, and that affects on your health. So what starts? It starts from, calcium leaching out. So usually we see that the, women are getting osteoporotic issues because there is, loss of calcium in the body, or they have the diabetic issues, or they go into a cardiac issues. So this is the main thing. Weight gain, लाइक बोलते मेनोपॉज के बाद यार मेरा लोअर हिप बढ़ गया, स्टमक बढ़ गया, that causes insulin resistance, and insulin resistance leads to, it's one of the factor which we have been talking in all the AMs also in the previous, like what is insulin resistance, and that leads to diabetes. So this is like, these are the main thing. Then on top of it, there are times, the female might slip into a lot of depression or an anxiety issue. So along with the doctors, like this is a clinical help, they also sometimes needs a psychologist help too, to come out of it. Because the one change in a hormone can change the equation of full body, and that takes a toll on women's health. You start getting changed, the body changes, and you are not able to accept that, and that leads to you, in a different zone, and you feel like what is happening. So here, lot of doctors help is needed. You need a right kind of a food also. It's not only कि, menopause आया तो सिर्फ आपने exercise करा, जो खाना है आप खाओ, you just take care of your body, but you need all the help: food, exercise, keeping a watch on the symptoms, preventing before it goes worst. So this is very important.
Okay. Right. So that makes sense. And I think there is also like a cardiovascular aspect, the impact on health, right? Heart disease, that sort of thing becomes more of a risk.
So it is dual thing, it can affect on your diabetes also. So it has been seen that most of the women do suffer with the diabetes post menopausal, and there are times many people, like most of the women get into the cardiac troubles. So this is because the estrogen goes down, and that causes an impact on your arteries to, become thicker, and that affects the plaque and leading to the cardiac issues. So here, taking care of the food plays an important role, and the exercise. That's why I'm emphasizing on this. So when
Mm.
hormones are going down, you need to take care of it.
Yes.
And along with this, even the diabetes, which is what we are going to talk today about. So diabetes is also something which is very important to take care, and menopause and diabetes is like a dual challenge to for the women. There is, the reason, most of the time this happens is when the estrogen goes down, progesterones are going down, the mechanism to the responding of the insulin changes. The insulin, we know, is a vehicle to transfer sugars into energy into the cells, and that's when the resistance happens, and there are times the sugars go high or completely low, and this is where we need to take care. So it is very important at every step we take care. So if you are already a diabetic and going through the menopause, it's always important to watch on your sugars. Always make sure you are keeping a track through SMBG at home. If the readings are really going high or low, it's always better to keep your doctor and the gynec under the loop, so that they can help you manage both the things together. Doctor, the diabetologist will take care of your sugar medicine, and the gynec will take care of your menopause. It is a team effort. So it's always make sure that if you're going to one doctor just to save money, or you are just tired of doctor visit, you are not going and neglecting that fact, don't do that. You need both the help. It is just a moment of a year and half where you need all the help. Once you are out of it, you are done and dusted. This is very important.
Right. So the exercise, it also comes into play with respect to weight gain and such other risk factors which also affect the diabetes, right?
So exercise, why? Because when we get a menopause, there are changes, and it affects your hormones, and that is affecting your sleep too. So due to hot flushes at night, you wake up, and that is not, and that, if your sleep is disturbed, it's definitely going to affect on your sugars, it is definitely affect your day to day activities. So when you exercise, it helps in decreasing your stress, and that's how it improves, it elevates your mood, it helps in improving your anxiety, your sleep pattern, preventing you from the weight gain, improving your sugars, improving your blood pressures. So it's just a 30 minutes matter out of 24 hours which you have to take care. If it's not that, even if you do, if you cannot remove, like daily, because you are usually females are bound with lot of works. So they feel कि पूरा दिन तो हम काम कर रहे हैं, उसके ऊपर आप मुझे बोल रहे हो 30 मिनट जाके वर्कआउट करे, कैसे होगा? So it's not always that that daily you do. You remove 3 days a week, you remove 4 days a week, do the exercise which you like. It's not कि आप exercise gym में जाके ही कर सकते हो. You can do yoga, you can do swimming, you can play badminton, you can go for a walk, jog, do whatever you like, go for dancing, aerobics. It's choice matters and happiness matters. Whatever gives you happiness, do that. Ultimately you are doing an exercise, we need that, but the choice is yours. That's important.
Right. That makes sense. So, in addition to exercise, we also need to look at diet, right? Like
Yeah.
the kind of food we eat to control weight, to control the diabetes. So, what kind of changes in diet would you recommend?
So diet, of course, it's a very bigger part in any condition. Like कुछ भी हो, डाइट, इवन कोविड होता है तो हम बोलते हैं डाइट पे ध्यान दो, लाइक फूड पे ध्यान दो. आई वुडंट से डाइट, बट आई वुड से फूड चॉइसेस. दैट इज अ राइट टर्म. डाइट मीन्स वेट लॉस के लिए ही हो जाता है. So food choices, usually when, so there are two kind of choices when the menopause is affected. So if it is very severe, the first, the hormonal replacement therapy doctor usually use. Before going there, doctor will ask to improve your food, improve your exercise. So this is the two things. Now coming, going little down on that, we need to first understand, as I spoke about, that menopause affect your bones, menopause affect your sugars, affects your weight, affects your heart. So what does this call for, like what kind of a food is needed? We spoke about the estrogen goes down, so we have to take care of that. So nature has given the food also which has a phytoestrogens in it, which mimics the action of what the hormone estrogen does in the body. So we can select such food. We have to select on calcium, so starting from calcium rich food. So that helps in preventing your osteoporosis, for the losses of bones and fractures and all in the woman. So going for milk and milk products, you have like green leafy vegetables in the diet. So this is very much important. When you put non-veg, when you add eggs to it, so this is something when you have to look forward for the calcium part. If it we have to talk about the phytoestrogens, so have, so for the hot flushes to improve, for your sleep to improve, we need something which is antioxidant rich, which has phytoestrogens in it. So adding flaxseed, we usually see ki, dietitians give flaxseed to the menopausal woman who has a hot flashes and problem. So you can have flax seeds, you can have sesame seeds, you can add soya bean. So all this has a particular, flax seeds has a lignin which acts as a phytoestrogens. So it helps in improving your hot flashes. Soya beans have isoflavones, which works as a phytoestrogen. So it works in improving your symptoms. So that is required. You need sesame seeds. You have nuts like almonds, walnuts. All this you add. You add tofu. So all these ingredients you add in your diet. You add fruits में strawberries, berries. This is very important. So अभी तो season भी है, आप डाल सकते हो peach, dry fruits. So this is very important in the diet to be added. Avoiding the packet foods. You have to avoid the food which causes like caffeine, like a lot of coffee intake, lot of tea intake, lot of cold drinks, beverages like which has highly sugar in it. You should avoid that. That's going to affect not only your mental health, but it's going to affect your sugars also. It's going to affect your weight too. So here we have to prevent the weight gain. We have to improve your metabolism, because with the estrogen going down, your body's way of burning energy goes down, and we have to prevent that. We have to accelerate that. So we have to go lesser on such foods and prevent yourself from gaining weight, because weight gain is it will just affect all the part of the body. So you and adding a lot of high you have to avoid the alcohol or spicy food that increases the hot flushes symptoms. So this is also very important. So keeping in mind that you have lot of fruits, vegetables in your diet, go lesser on the high oily food is very important. This is the crux of improving your menopausal symptoms.
Okay. So, one thing that is discussed in terms of menopause is hormone therapy. So, how would you say that, like, is it helpful, or do we just focus on just food?
So it is again a doctor protocol. So if doctor feel that only, so here the food is corrected and still the person has not improved, then they are put on that. So it depends upon doctor's thing, because they evaluate the patient, they go detail into it, what is needed. So it's purely a doctor call. We are no one to interfere in it. That's why it's always better to see a gynec, so they can route you to the right line, rather deviating from here to there and listening to the people कि अभी ये आया है तो आप ये घर का कुछ नुस्खा करो, which is not at all meant for it. So every time whatever occurs, it's always better to take a professional help, I would say.
So, maintaining that medical core of specialists
Yes,
who can help you,
yes,
that
yes.
is very important. Right. So,
So
if you had to, sorry, you were saying?
no.
Okay. So if you had to kind of, sum up some of the foods, like proteins and fiber, or for example, you talked about fruits, and dry fruits and things like that. So when you bring this into context of diabetes, then we also have to look at, low GI, things like that, right? So food that
So
won't increase the blood sugar quickly.
so ultimately, it is one and the same which we are talking about till now, that you have to just prevent yourself from eating all stuff which you do it for your weight loss. That is like not going for the high fried and the packet food and a cheesy food and all. Add lot of fiber kind of oats hai, wheat bran hai, bajra hai, nachni hai. So you add all this stuff to your diet. You add lot of fruits without puring it or juicing it. You add lot of vegetables or a vegetable soups. You add nuts. So this is what is very much important in the plan to improve your symptoms, in keeping your weight stable, keeping your sugar stable. So it is same, but we have to understand that the importance of it and eat timely. Don't go worst on, like don't go extreme कि नहीं खाना है, वेट लॉस करना है, नहीं होगा। कम कैलोरी खाने से वेट लॉस नहीं होता है। न्यूट्रिशियस फूड खाने से वेट लॉस होता है, दैट इज इम्पॉर्टेंट। वी हैव दैट ट्रॉमा, कम कैलोरी खाया तो मेरा शुगर्स भी कंट्रोल हो जाएगा, मेरे सिम्टम्स भी इम्प्रूव हो जाएंगे। इट इज़ नॉट दैट। You need a proper water intake also to improve the bloating. You need a proper food intake also to improve the symptoms. So this is very much important कि आप जब भी कर रहे हो तो don't go extreme. The frustration will pile up more faster than anything.
Yeah, that's true. Okay. So, in addition to all of this, what other, like off the top of your head, or if you had to say like top 5 ways to control or to manage or deal with menopause when you also have diabetes?
The first thing is always monitor your symptoms. If it is going extreme, it is important to take call. Second is make sure that you are checking up on your sugars. It's not that today it is normal, tomorrow it's going to be normal only. So keeping watch on your sugars. Third, you have to make sure that you're taking medicines on time. It's not that today you take it, tomorrow you don't, or you miss out because your sugars are getting normal. So that is important. Eat right food, a nutritious food, I would say, so that it keeps you balanced between both the things. And the last, exercise. Exercise is important. So these five things are really important because menopause comes in the later age, which is affected by your lifestyle, age, genetic changes, and everything. So body is dealing with 100 things at a time. If so, you need to be make sure that you are calm first, and then you take a call and follow each step by step to improve all the things and make your menopause as a balanced one and not the challenging one.
Hmm. Hmm.
That's important.
And so you spoke about how, once the menopausal period is over, then it's like done and dusted. So what exactly happens after menopause,
So
ends?
it is the same thing which is gonna happen where your hormones are gonna be on the lower zone. So it's just that you pass that symptom phase. So you
Okay.
just so the symptom phase are over, things take a very good turn. But if you have, so for some people it lasts for 2 years also where the symptoms are there. So you need that, then the therapies and all is required. And for some people in a 6 months also they are done, and 12 months also they are done. So as I told that every body is different, every body is a new case for us to understand what's happening. So after menopause the caretaking becomes 200% more, where you have to take care of your vitamin D levels, and where you have to take care of your calcium levels, and you have to keep a check on all that stuff. So that's why we usually say once you cross 30, 35, you have to take once a month vitamin D. Usually, as a population, we are low. And if the vitamin D is low in the body, the calcium is not going to absorb well. So, all this matters the most. So, one counseling is very important for the person to understand कि this parameters are important once I achieve the menopause.
Hmm. So, vitamins, calcium, because of the osteoporosis, and vitamin D for absorbing the calcium. And what other deficiencies might occur at
These are
that
the
time?
two important deficiencies which we need to take care. And of course, always put a watch on your iron and hemoglobin levels.
Okay, okay. So, is anemia a risk or like?
It's not a risk, but if you face a lot of bleeding during your menopausal phase, then it can be a risk factor to you.
Okay, okay. Yeah, that makes sense. So, I just want to kind of, recap what all we have discussed in our session today. So, first, we were talking about what exactly menopause is, and, the end of the menstrual period in a woman's life. So, you said that that usually can be anywhere between 6 months to 1.5 years, maybe
12
in some.
months is usually, so 12 months, for 12 months, if you don't get a period, so this is what the menopausal phase is.
Okay, so the average is always going to be around 12 months,
12 months, yeah.
right? And during that time, people will end up experiencing certain symptoms like mood swings because of the changes in their hormone levels, and experience hot flushes, temperature issues when it comes to their body. And at the same time, you said that insulin resistance can develop.
Yeah,
So,
because there is a weight gain happening in certain
hmm,
females, and that causes a insulin resistance. And when the hormones goes down, the ability of insulin to respond also changes. So that's why there are chances that if they have little genetic impact and their lifestyle is bad, they might fall into a diabetic zone. So that's where we
Okay.
say कि अभी menopause आ गया है, ध्यान रखना start कर दो.
Okay. So basically, what you end up seeing is that a lot of people develop diabetes during
So,
this.
like I wouldn't say, but there are like it's a 50-50 thing. Most of the female get the diabetes post-menopausal, but there are people who have already into the diabetic zone and they have got them. That's an ongoing thing. So
So then their
menopause is
symptoms are going to
yeah,
get worse during this time. Right. So in both cases, basically, what has to be taken care of is, regularly monitoring the symptoms of both of menopause and
symptoms,
diabetes.
sugars, blood pressures, your weight. This all is important. So
Oh,
this is like if you're figuring one thing, it shouldn't be like you're living out the other thing. So everything plays a combined role in it.
yes. That's also why you've been stressing that it's important to have your diabetologist. It's important to have your OB/GYN. Everyone in the loop, everyone monitoring the symptoms so
Yes,
that the
yes.
best treatment can be given. Right. And you have also stressed that like lifestyle changes, food, health, eating habits, and exercise as two of the main things that can help you.
Mainly. So everywhere, if you say the diet, the food choices and the exercise has a upper hand.
Mm.
It is like a game changer for everyone. So usually when the menopause strike, people go for a yoga more than an exercise because yoga is something that helps in not only releasing the stress but it also improves all the body parameters. So usually post menopausal, I've seen people, women usually opting out for the yoga as they get that happiness after doing that exercise.
Okay. Yeah, we actually have a daily yoga session
So
in
that's the best
our
thing we are doing it for the people out there, and the female should usually they should utilize that.
Yeah. So basically, you're saying that even more than other kinds of strenuous workouts, yoga might be relaxing as well as giving the benefit of
It gives
exercise.
100% benefit, the asanas and all the breathing in and out exercise, because yoga focus on all the things, and
Mm-hmm.
that brings a lot of calmness in the mind, that helps in improving your anxiety levels, ultimately improving your depression, and ultimately working on your hormones. So it's like
Right.
one thing and you are getting all the benefits.
Okay. Yeah. So that would be like a, like most preferred method of
Yes, yes, yes.
exercise.
Most, and there are research backing up. So there are
Hmm.
many research. If you see yoga and diabetes, and it has shown that the yoga helps in improving your sugars,
Hmm.
fasting sugars.
Okay.
It helps in improving your insulin resistance in the morning. So there has been a research, and it's not that I'm just talking randomly, but the research too tells that. So that's a good thing our community is doing for the people out there.
Yeah, and as you mentioned, like many women, they are busy, they might be working, they might have the housework. So rather than doing multiple things to manage their health, if there is one single thing where they can get many benefits, then that's even more better, I guess.
Because women has lot of things to undergo. They go from lot of changes from childhood to adulthood to the elderly. Every stage they are changing their hormones, and once the pregnancy is done, the hormones change are supremely different,
Hmm.
and they have a lot of things in mind. So they are the person who are handling the home, they are handling the kids, they are the generations, and the the male part, of course I wouldn't say that they are also not doing anything less, but women are always two step ahead, and they are managing everything, and their hormones are more impactful because when they set into the puberty zone, so there are changes. Then they have every level they are facing the changes with the body structure and all. So sometimes that there is some emotional impact in the mind, and that can come out during your menopausal phase, and that can affect you. So it's always why these days we are focusing more on being positive, and talk good, and listen to the good things, and affirm your things. So this is the reason to just come out of it.
Hmm. Yeah, yeah, I think people will also get tired of, like constantly having to deal with different hormonal changes, different, especially mood swings and things like that will be affected at almost every
Yeah,
stage.
so now if you see, the PCOD is also so common. Like
Yeah.
every one, like I would say, 8 to 9 female and 10 females are PCOD. Like we say that I have PCOD. The girls, alternate the girls, I see that they are having a PCOD issues. So understand, the food quality has changed, the way of our functioning has changed, and that is impacting us. Nature is telling us to be under subtle zone, but we aren't, and that is what is coming up on the body. So it's
Hmm.
always better. So it's not only the menopausal women who are listening now and they should take care of it, but the people who are listening, who are into the younger age too, should start managing their lifestyle, so that when they come to this stage, they are not facing any of the severe symptoms. When your body is equipped with all the vitamins, minerals, proteins, fats, and energy, nothing will happen. When the body is equipped with one thing more and the other nutrient less, then that is going to affect your body. So
Hmm.
keeping healthy from the start is important, so that you don't reach to this state and gets affected.
Right. So even before we have to worry about menopause, it is important to start thinking about a balanced diet, exercise, these components getting included in our lives.
Keeping yourself under normal category is important. I
Hmm.
wouldn't say very normal, but a normal food category is important.
Yes. Okay. So, thanks so much, Ami, for
Welcome.
taking the time out to explain all of this to us. And I think this has been very helpful for, like, not just, I guess, not even just our female members, even the male
For the
members will also find it informative for their relatives, for their friends, everything. So, thank you so much for.
welcome. And it's always a pleasure coming on this platform and talking about various topics. Looking forward for
Yes.
more.
Yes, of course. All right. And thank you everyone who has tuned in, and everyone who will be watching the recorded session later as well. We hope that you found this informative, and we hope to see you again next week for another AMA.
AMA.
All
Thank
right.
you so much, and happy Makar Sankranti to everyone.
Yes.
Yeah. Okay.